you talked about finding a provider that can work with you and you can have a relationship with over a period of time to address obesity. How does that work with telehealth? I mean, how does telehealth for obesity medicine work?
Yeah, it's a great question. And right in my wheelhouse. So I would say I've been really surprised. So back in during the pandemic, 2019, 2020, when many of us were forced to change the way we deliver healthcare, a lot of medicine doctors were forced to deliver care via telemedicine, via telehealth. Um, it really was an eye-opening experience for me because I was practicing obesity medicine at the time, seeing patients, in the traditional clinical setting. And come to my clinic, you're in the four walls of my little white prison that we have that you go to, and providing pretty good care. But what I found was I could still have very meaningful interactions with patients via telecommunication. And I was actually really surprised, pleasantly surprised, to realize that our relationship, the dialogue didn't suffer, that we were still able to do very thorough assessments just through the verbal, the auditory history taking, and that there are a lot of technologies available now that allow us to wrap them around a patient and create what is otherwise a virtual clinic right at home. And I think the combination of the advancements in these technologies, the public embrace of telehealth as a legitimate modality of care has really opened the door for another way of providing care. And I view this as a real positive, especially as we have more and more data come out validating its use. And that's because there are several things that patients with obesity really still struggle with today. Access is still lacking. Issues around sort of the stigma that we talked about and making care more accessible, issues around social determinants of health. Can I take off from my job just to go to the doctor on the other side of the city, or travel 2 hours to the nearest specialist? All of these issues and many more actually can be solved in meaningful ways using digital health and telehealth ways of delivering care. And so I view it as a very important evolution in the way that we provide healthcare in the US. I don't view it as a substitute for in-person care, but as a useful addition as part of this care continuum that we continue to talk about. What does care look like in the future? How can we make care better? How can we extend and augment the care that's already being provided so that more people can get this high quality care? We ultimately want to make care more accessible. That's everything we do within my company. That drives us at a fundamental level. How do we make care more accessible? What we found is that telemedicine has allowed us to do that, reach more people than we could have ever imagined. And from my standpoint, that's a good thing.